home and watching the news or seeing on social media that this is a hoax has been the hardest.
Months into the battle with no end in sight, healthcare workers on the front lines of the COVID-19 pandemic are fighting the virus and skeptics. Inside hospitals across central Indiana, Hoosiers are putting their own lives on the line to keep families whole. Tonight, those heroes are sharing their experiences with you.
Hi, my name is Warren Gavin, and I'm a medical doctor and a hospitalist here at Methodist Hospital.
My name is MYRA Whitaker, and I'm a staff chaplain here at Methodist Hospital.
My name is Jody White, and I'm a respiratory therapist at Methodist Hospital, downtown Indianapolis.
My name is Brandy Copsis Kingsley, and I am a shift coordinator at University Hospital for the medical intensive care and rapid response teams.
They have different roles and their own families at home. But when the world faced a new health crisis, they all shared the same call.
I felt like it wasn't even really a choice. Like it wasn't okay, I don't want to do this, or should I do this? It was, this is my job. This is what I'm here for. This is what I've been trained to do, is take care of the sickest of sick patients. So we just jumped in and did it.
As a nurse, as a healthcare worker, you just run right in, right? You just jump in and you start trying to save a life. You don't think, oh, if this person coughs on me or if their blood gets on me during this, that I now could be sick and then I could die. You don't think those things.
Those risky situations are now a part of daily life for healthcare workers. The new normal brought on by COVID-19.
Coming into this place day to day, when it first started and it started hitting this hospital really hard, knowing that that's what we're gonna be doing all day long. Going in these rooms, in and out, having to wear all of this extra stuff.
At the same time, they are learning everything they can about the coronavirus.
So you would come in and you would treat the disease, all week, and then you would research the disease, and there was no reprieve from it.
And working to keep everyone safe.
There's a lot of figuring out how we're going to be adaptable and flexible, especially with staffing. It was a lot of work to try and keep people safe and just use the evidence that we had to also keep the staff safe.
With everything they have learned, these heroes are working to provide the same level of care and comfort for their patients.
Not being able to be with the patients in a way that I would like. A lot of patients, if you're able to go in the room, they'll say, they miss that touch. And so we oftentimes underestimate the value of presence, just being able to be with the patient. Now we're outside the room a lot of the times, looking through the window, even calling them on the telephone, trying to get hand gestures, smiling with our eyes so that they could see us. But just being with the patient is a challenge now.
And I don't even know how sometimes to explain it to people that are on the outside. These people have no families here. Like we're their only communication. Little things like that just started adding up day after day after day. When we would come in and it would be the same thing.
I think I'll never forget, the fear and the uncertainty when things first hit, and you saw patients decompensate faster than you've ever seen them decompensate, and you felt helpless to combat that. I think that's going to be a tough feeling to shake.
Now with the surge in COVID-19 cases, healthcare workers are pushing past their fatigue to share a message with their community.
I think we have seen a change that I can't explain, but a change in the disease itself. And we are getting better at treating this disease. And so the therapies have evolved, from the medications that we're using to the respiratory support that we're providing. We're better at this. But that doesn't mean to let up on the masks and the social distancing because you still don't want the disease. But if you unfortunately get it, we're better at this. We're better at getting patients through this.
Although they will continue to fight, they need everyone else to do their part too, so we all can one day see an end to this pandemic.
This disease is real, and this disease is killing people, unfortunately. And the number one thing that people can do is to wear these masks and to socially distance, and they'll save lives by doing that.
Because we're still fighting, and the numbers are rising, and the hospital admissions are rising, and the deaths are rising. And anything that we can do as a community to help each other is just gonna help everybody.
And tomorrow night, you will hear from the same healthcare heroes about the impact the pandemic has had on their families and how they find hope as the pandemic continues. That's tomorrow on the news at 11.